Welcome, everyone, to our next session on promoting inclusivity and diversity in scientific conferencing. My name is Teresa Cruz. I have the honor of directing the National Center for Medical Rehabilitation Research at NIH inside the Eunice Kennedy Shriver National Institute of Child Health and Human Development. And today I'm going to be moderating a very exciting fireside chat with three people who I am just so excited for you to get to meet and to get to know better on a topic that's very dear to my heart, and that is creating an inclusive conference environment through disability, inclusion, and accessibility. Before we get too deep, I do want to remind you that if you would like to ask questions of our guests, and I hope that you do, please put them in the Q&A. That's where I will be looking for them at the end to do some questions from the audience. There is also a chat function where you all, I hope, will react and comment amongst yourselves as we go through this session. So as I said, my name is Teresa Cruz. My pronouns are she, her. And I am, my visual description is a 40-something white woman with chin-length brown hair, blue eyes, and I'm wearing a light-colored cardigan today. So I'm going to hand it over to each of our speakers to introduce themselves. So we'll start with Lisa. Dr. Meeks.
Wonderful. Thank you. Lisa is my preference. So I am Lisa Meeks, she, her, and I'm an associate professor of learning health sciences and family medicine at the University of Michigan. I also direct the Docs with Disabilities initiative, and my visual description is a 50-something-year-old woman with long brown hair, green eyes, glasses, and a black top. I'm excited to be here.
Thank you. And I'll move over to Bonnie, Dr. Swenor.
Yes, thank you. I'm Bonnie Swenor, the Endowed Professor of Disability, Health, and Justice at Johns Hopkins University, and the Director of the Disability Health Research Center at Johns Hopkins. She, her pronouns. And my visual description is also wearing the same uniform as the rest of my panelists, dark top, dark rimmed glasses. I have a little bit more than shoulder length blonde hair these days, and am also a 40-something white woman. I'm really excited to be here with all of you.
And last but not least, Jenny.
Hello, everyone. I'm Jenny Phan. I use she, her pronouns, and I am a newly minted Assistant Director of Community Engagement and Research Assistant Professor in the Center for Adaptive Systems of Brain-Body Interaction within the College of Engineering and Computing. And that was a mouthful, but that's all at George Mason University in Fairfax, Virginia. I am wearing black glasses, a dark black blouse with rainbow hearts. I am a Southeast Asian American, late 30s woman with dark long hair, and I'm very happy to be here. Thank you.
Thank you all for joining. I think we should probably start with a couple words about language. So the disability community is very broad, very heterogeneous, and within that group, certain subsets prefer different language. Things like people with disabilities versus disabled person. So we're going to use those terms interchangeably as we go today, but recognizing that for certain groups, certain terms are more preferred. There will be words that we won't be using. And if I see any of those in the Q&A, I may alter to more acceptable terms and change questions in that manner. So let's start off with some basics. What do we mean by disability? What are we talking about when we say we want to be accessible and inclusive? And maybe I'll start with Bonnie on this.
Yeah, it's a great starting question. So thank you, Teresa. Disability is a large community of people. And, I ascribe to a more of a civil rights guiding definition of disability. And there are people who are disabled who don't identify as disabled, but still would be protected by our civil rights laws, for example, right? So when we're thinking about including people with disabilities, I say that because we're not just talking about people who would necessarily identify as being disabled. We are talking about people who have disabilities. So people from all sorts of categories of disability that may face barriers to participating in science, in conferences. And so to me, that's the group, and it's quite large, that we are talking about. I'm often pinned or held to giving a very solid definition to which I admittedly skirt around because that is still needing dialogue, admittedly, from more of a research definition approach, which is why I think we need to think more about a civil rights approach right now.
Jenny or Lisa, would you like to add to that?
I think my thought was when Bonnie was saying, there are people who would be protected that wouldn't identify as disabled. And I think many people, what I would add to that, I completely agree. And I'm really glad that Dr. Swenor brought that up because we don't hear about that distinction very often. But I just want to recognize that many of those people are motivated not to identify as disabled, both by societal ableist beliefs, but because of the scientific community's beliefs and the medical community's beliefs about disability as well. So I think as we continue this conversation and we think about, people that are disabled, if we're going to identify them and how they're interacting with our conferences or our large meetings, thinking about what we're doing more broadly to welcome people and make it safe and okay to even think about identifying as a person with a disability.
Thank you.
Just to kind of add a little bit more to some of my colleagues' comments, I was thinking about how many Americans exactly there are that have a documented disability. And the number that I found from the Survey of Income and Program Participation, SIP data, is approximately 54 million Americans. That's a very significant number of our neighbors, families, friends in the community who have a documented disability. So my next thought was, why haven't we reached universal design? That's such a steep conversation where part of the barrier I hear a lot is it's expensive. And I understand that it is expensive to reach universal design, but it's worth investment, at least starting from step 1 to however many steps we need to take to get to that point. So to me, if we have that many fellow Americans with a disability, we have to really get to the root of figuring out how to promote universal design. And that's inclusivity and that's accessibility.
You're teeing me up for the next question. That was great. So when we talk about accessibility and inclusion, they're common words and they get used by lots of different groups. So maybe we could ground this a little bit more in what do we mean by accessibility and inclusion in the context of disability? And some examples would be helpful, I think, to our audience. So who did I start with? I started with Bonnie. So maybe I'll start with Jenny this time.
Yeah, so just to kind of, I guess, expand on what I started to say about universal design, um, it, there are great models that are available. So this is not starting from scratch. If we are truly serious about making our environment and spaces more accessible and inclusive for our disabled community members, then we would go and look to these established models. And I'll drop some of those models in the group chat so everyone can see. But there are fantastic researchers who have already developed these universal design models that we can build off of. Why not? Let's not reinvent the wheel if we don't need to, but why not use these models, improve it, and figure out what multiple ways in which we can target specific disability populations and do focus group interviews, co-production, co-design, where we get the input from our disabled community members and how to truly implement universal design in specific spaces. And so I'll get to the root of a lot of these issues, which is let's make our world more inclusive and accessible for everyone. And in turn, everybody benefits and not just our disabled members of the community.
Lisa or Bonnie, would you like to add on?
I love the idea, and I'm excited to see the resources on universal design. I think when I think about kind of these being common words that are tossed around and what does it exactly mean, I think even the question brings up a good issue, is that many people don't know what it means, right? So when we say things like, we need for you to be inclusive and accessible, accessibility could mean different things to different people. So defining that is really helpful. I do think when people are aware of what accessibility means, they're thinking in more transactional ways. So in other words, you don't have access physically to the space, we need to remove a physical structure barrier or have an entrance where you can come in, or they're thinking things like CART and ASL to make sure that someone who is deaf or hard of hearing is able to access the information. And this is really important, right? But it is that in that transactional mode, it is very basic and not comprehensive of everyone who could possibly need an accommodation to thrive, not just to have access, but to be able to actually get to a conference and thrive in that space and do what conferences are intended to do, which is connect with their peers and, engage in the science. And so I think one of the things that concerns me is I don't see very many people focusing on cognitive-based or chronic health-based disabilities, which are the largest proportion of disabilities that we see, that the research shows us are in STEM and in medicine. So things that would allow people to reduce their cognitive load, things that would allow people to rest, even expanding the time between talks. Many times we go to these large functions and it's 15 minutes between a talk where you have to get from one side of a very, very large building to another side of a very, very large building. And so conferences can be exclusionary just because they're exhausting for people between the cognitive and physical loads. So I think mostly we're focused on some areas, if we know at all what we're talking about with accessibility, and not necessarily comprehensively.
Yeah, this is Bonnie. I appreciate all the things that have been said for sure. I guess I would only add or add to that, I think for most in STEM, this seems overwhelming. And that's the feedback that I consistently get. And I just want to say, that shouldn't be a reason to not do it. And what I mean by that is, I constantly get responses to requests and conversations around how to make any kind of STEM environment universally designed or more inclusive for disabled people. With this is just too much. This is too complicated. There's too many different groups of you people, you people meaning as a person with a disability, right? People from the disability community. But that really is a consequence of us not teaching lessons of universal design, of accessibility, of disability inclusion as core principles of STEM. And that has to change, quite frankly. This can't be an add-on that you learn, on the fly when you get in trouble for not having an accessible conference. This has to be something that we are teaching the next generation on how to host all convenings and meetings and conversations and opportunities. And of course, people don't know how to do this because they haven't been taught. But that's exactly what we have to change. I also think that people want checklists, right? And I get that. And I think there's opportunities to develop some starting points. But I think just like we're having conversations, like I think we're having in other places in this conference of how to make conferencing more environmentally friendly, it is a journey, right? It is a constant journey where you can improve. And, over time, things will get better and technology will change. And so I think that we need to approach this like that, but there still does need to be guidance and training and opportunities. And so I will also add that there has been some of that already developed. So we don't have to start at zero either. So I will put in the chat, Kate Mittendorf at Vanderbilt has developed a great guide on conference accessibility and design. The Ford Foundation has a wonderful toolkit of making any kind of convening disability inclusive from the beginning to the end. And my center had actually NIH funding to create a toolkit for making conferences accessible. And so I think it just takes some, time to learn, as my colleague said, just some basic principles.
Thank you. So I think in that round, you hit on a lot of physical barriers, which are maybe a little bit easier for people to get their hands around. And those were backed up by attitudinal barriers, perhaps. So can you talk a little bit more about those attitudinal barriers that people with disabilities might face at a scientific conference? Do I have to pick on somebody? We'll go to Lisa.
Oh, okay. So I mean, attitudinal barriers, I think it's hard to whittle that down because I think attitudinal barriers are the things that cause the structural barriers, right? So it's kind of all works together. But I do think attitudinal barriers can come out when I really think it comes out the most in kind of the perceptions and the responses of organizations that are hosting these events when an accommodation is requested. So why should I have to do that? What is needed? This is going to cost us money. Those are all attitudinal barriers. Instead of seeking opportunities to either make things more universally designed or choosing a more accessible location. Oftentimes, I think people with disabilities are viewed as, the very few. So, why are we going to do all of this and change a space or have an accommodation for one person, right? I hear this a lot, unfortunately. Why do we have sign language interpreters when there's one person? Or we don't even know that there's going to be someone when we're pre-planning. And so those are certainly attitudinal barriers. Sometimes you talked about language earlier, and you were doing a great job just situating that there are really two schools of thought on language, one being identity first language and one being person first language. But I think we can all agree that within either one of those models, the idea is to be respectful. One of the things that might come out as an attitudinal barrier is the use of language that others people and that is kind of that's either not in favor anymore or that has historical meaning that might be bothersome or triggering to people. In the last year alone, so we're not talking about 1970, 80, 90, the last year alone have seen the terms handicap used, which I think we can all agree is out of favor. within the last 6 months, I've seen the term special accommodations. So I say special in quotations. This idea that you need something because you have an issue. And I think for many, this brings up, memories of being othered and moved into different spaces and all of their schooling. And it can really lead to people saying, you know what, I'm just not going to even ask. The term hearing impaired, while not technically wrong, I think, it doesn't land well with many people. So not using the preferred identity first, deaf or hard of hearing in those cases. And I think also a way that attitudinal barriers come out, a lot of this is, again, in language and in process, is when you're asked if you need an accommodation in the registration form, which is wonderful, but then you're given this kind of nondescript email address for communication. For some of us, I think communicating about our intimate disability related needs would be problematic for us to just have to be interacting with an organization with no identification of who this information is going to or who it'll be shared with. And so those are just a few ways that I see things come out.
That was great. Thank you. Um, Bonnie or Jenny, would you like to add?
I concur entirely with what Lisa was saying, and actually, Lisa was touching on a couple of my thoughts as well. So thank you for that. I'm not sure who's in our audience, but in case this would be helpful for our audience members, I looked this up before we jumped on this meeting, and read that the Americans with Disabilities Act accessibility standards, it reads as accessibility standards issued under the Americans with Disabilities Act, or ADA, apply to places of public accommodations, commercial facilities, and state and local government facilities in new construction, alterations, and additions. And I bring this up because I know, Teresa, you brought up about attitudinal barriers probably impacting physical barriers. And I think a lot about the multitude of ways that physical barriers can be addressed. And this is more like front and center. And of course, the attitudinal barriers, it's a process to confront and address. But I think with the things that we can see before our eyes could be something that help us to recognize that there are things underlying why these events and conferences and structures are not accessible for 54 million Americans. And I would go to conferences, and my research area is in autism and intellectual and developmental disabilities, so cognitive learning disabilities. And my colleagues who are autistic would spend most of their time in their hotel room rather than going to talks they had planned to go to. And I would ask, why? That was a fantastic talk. I wish you would have been there because I think you would have amazing input to provide with the presenters. And conferences can be overwhelming. It's for everyone, overwhelming for everyone. It is particularly overwhelming for people with sensory sensitivities. And we're talking about sounds, lighting, touch, the intense schedules. So for many people without these sensitivities, that can be overwhelming for them. It is multiplied by 10 times for autistic people. And so I talk about what are some ways that we can help our autistic colleagues to participate at conferences and not have to hide in their rooms the entire time. And I would share with them my noise canceling headphones because I would always bring an extra and share it with them. But why are we not providing that at the registration tables? That could be something that's provided. Maybe noise canceling headphones might be too expensive. What about earplugs? Those are pretty inexpensive. we can just have a basket of those sitting at the registration table for anyone with noise sensitivities, or glasses that filter bright lights. There are inexpensive glasses that can be given out to people. And doing a quick, screening of attendees or presenters, asking, are these accommodations that would be beneficial and helpful for you, and get a number. And if there's a significant amount of people who would say, yes, I need those accommodations, it would be worth it to put them at the registration tables.
Thank you. Bonnie, do you want to wrap this question up?
Sure. Great comments. And, I guess I would just also add that too often disability is diversity adjacent, I would say, if included at all. And, I think that applies and has implications in this conversation for conferencing. I think as we're thinking about the ways in which conference structures are keeping people out, too often we're not even thinking about people with disabilities. I know we are in this space, but for example, in this conference about scientific conferences, the session before us was about diversity. And so it's interesting. I mean, while important, we are having our own conversation about disability and accessibility, but we also need to be a part of those larger conversations about how to diversify who gets to go to conferences, right? We're part of that conversation too. And I think that, the assumption still remains that we're just not going to show up, like Lisa said, right? Our presence is radical, is what I always say. And there is still this attitude that our presence is a deficit and a cost. And that is really hard to change. And I think that is what has to change. And it needs to be about, and I think what Jenny described as, the ways in which we can create cultures of inclusion from a framework of what science gains, instead of thinking about it as, oh, we've got to do all these extra steps and just ending the thought there. It should instead be about, we are missing a large group of people that have meaningful and important contributions to science that haven't been there and just might be the keys to certain solutions and the reason we haven't had progress on certain areas. So yes, we should be investing in this. And, it's a viewpoint that I often get when I need accommodations when I go to a conference, and it's, sort of a, what do you need attitude, instead of how can we include you in a meaningful way? And I guess the last thing I would say for the attitudes that wraps into what we were talking about of how to design the conference itself is it is a bit of a flexible process, I'll be honest. And I think there has to be some comfort in that process, right? So oftentimes, if I request that I need an accommodation at the conference, if I do get an email, it will say, "So what do you need?" To which I will answer, "I don't know what's your setup." Right? I don't really know until I'm there. And so then there's no help or support. And so, the design needs to be more of, I think, like Jenny is even describing, a more flexible solution where we have experts and we have support staff on site that can help people troubleshoot and find solutions within the environment as they are. Again, through this lens of, we want you to contribute because you have something really important to contribute.
I love that.
Sure. I would just add to that, between what Bonnie and Jenny have said, there's this little bit of space that I think I'd like to make sure we understand. It's the opportunity cost. And that's not what's talked about, because when we talk about access and it's transactional, I need, like Bonnie says, I need either, magnified items, or I need information in advance. But when we think about science, you're on, especially for academics, you're on a track, right? And to continue to move up in your career, you must do specific things. Those things are usually catalyzed through conference attendance and meeting people, collaborating with people, getting invited to talks, developing a national and international reputation. These are all required to excel or thrive as a scientist. But when you go to a conference where yet you might have a sign language interpreter in the room for the talk, but you don't have true access and inclusion because you're not able to have someone with you in the kind of sideline conversations that are the most important conversations that you're going to have at a conference. So you miss all of these opportunities because you're either not in that space or you're not able to access that space in those conversations. For someone like me, I may be running upstairs. I was telling Bonnie earlier this week when we were talking about this presentation today, that early in my career, I would run upstairs, I would make a hot bath. I have significant arthritis, and that is how I would manage my pain from sitting in long cold conference centers that, where you're sitting all day. And I finally had someone tell me, thank goodness, you're being perceived as a little bit of a little hoity because you don't go to lunch with people or you don't go to the conversations with people. You're running upstairs and it seems like you're too important to engage with other folks. And I was like, and that just made me so sad because it's a choice you're making as a researcher, as a clinician, to care for yourself. And in the moment you have to care for yourself, you're missing opportunities. And why do we have to make that choice? It's because because standing in a conference room isn't normalized, because moving in a conference space and during a talk is not normalized. It's viewed as rude, right? We're socialized on how to behave. Having noise canceling headphones on, I would imagine, also comes with a set of perceptions that people may have been socialized to not do that because it seems rude. So whenever I'm giving a talk, and I've witnessed Bonnie doing this as well, to say, we are all adults. You do what you need to do to take care of yourself. If that includes, walking around or whatever the case may be, you do what you need to do to be comfortable in this hour or 2 hours that we have together. And then, having space in between the talks, as I said, to traverse these large conference centers without having to just absolutely kill your body. Last year, I think I had to run from one building to another, literally run, like take your shoes off, run. And that's not available for everybody. I kept thinking, it's going to kill me. I'm going to pay for it later, but at least I can get it done. And that's not an accessible space. That's not an accessible schedule. So maybe also thinking about how schedules need to be modified to be more humane for everyone. And eventually, leading into the universal design concept, that is going to be better for everyone in the long run anyway.
A curb cut example, if you will. Something that is in our environment and is ubiquitous now that was originally targeted for a certain group of people, but is beneficial to everyone, right? We all benefit from curb cuts. Delivery people, parents with prams and strollers, as well as people with mobility devices, right? I do want to go back to one point that I think is just amazing. The opportunity cost. People with disabilities are some of the most creative problem solvers I know. And, the work that NIH is supporting is hard. We are trying to tackle hard, complex problems. And we can't afford to leave that kind of talent on the bench. Just the acknowledgement that we could be going so much faster in the progress that we need for the health of our nation and our world if we were more inclusive. So I just wanted to put a plug on that one. I'm not seeing a whole lot of questions. So if the audience is sitting there and have forgotten about the Q&A box, I would encourage them to join this great conversation. So please do that. I do have a few more questions for you all, though. So, when I'm planning a conference and I'm talking to the people in the facilities, I ask about accessibility. And one thing they often say is, "Oh, we don't need to worry about that because there's no disabled people in attendance." So on one end, you have people saying there are no people with disabilities going to be there. And then on the other side, I hear people saying, Jenny mentioned the ADA, that's almost 35 years old. So clearly we have solved all of the accessibility problems. So we also don't have to worry. So it's very convenient. Either there are no disabled people there that we need to be concerned about, or all the accessibility problems have been solved. So you want to react to those statements? I'm sure you have heard similar in your attendance. I'm looking at Bonnie. We'll go there.
Sure. Yeah, I have heard far too many times in my career, there's just not enough of you for us to do anything, right? And it bewilders my brain, admittedly, because of course that's the view. Those structures have been designed to keep us out, or silence us from disclosing. It's a tactic of oppression, and that's just all it is. And it is, we need to encourage leaders to call that out, quite frankly, from the disability community and outside when those things are said, because it is hard as someone more junior and with a disability to call that out, but that is not an okay thing to say or an attitude to have. And as far as that statement, which you're correct, that the ADA is something that has solved all problems, as if the laws enforce themselves, could not be more incorrect. And, the first thing is, as Mary Lou Breslin, who, was a force in the disability rights movement and got us to the ADA, often says it's a blunt tool, right? It is the basement, not the ceiling. And that's the first thing to understand, that even if the tenets of the ADA were upheld, it still wouldn't get us to equity, which is where we want to be. And they're not being enforced, and there is no accountability. I'd say between the ADA and the Rehabilitation Act, there's extra legal teeth that we need to consider as well. And that when organizations are receiving federal dollars, they have to ensure that they are not discriminating on the basis of disability in their activities and their programs, like Jenny was describing. But are we checking that? And are our funders making sure that's happening? I know, in NIH funding, if you get funding for a conference, there's language around that. But are we checking to make sure that's happening, that discrimination isn't occurring, or those efforts to include people with disabilities are happening? I don't believe that's the case. And that's a challenge. And I'm not sure, where that check lies, but that's work we need to do. And I think that there does need to be, I think your question makes me think there needs to be efforts to design strategies for accountability. And I think that would be helpful to drive change and to change those kinds of views and attitudes. I don't would work best, certainly carrots and sticks, but in my view, the sticks tend to work a little bit better than the carrots.
I would just add that it's a circular argument, right? We say there are no people with disabilities, but there are no people with disabilities because scientific conferences aren't accessible. So, until you move on one, you're not going to see the other. And as I said earlier, until we create a landscape or a climate where people feel safe, they're not going to tell you. They're not going to ask for accommodations. So even if you set up a booth or you set up a a Qualtrics that says, if you're a person with a disability, let us know and we will provide this accommodation, in a competitive atmosphere where you're vying for funding and you're vying for articles and everything, your career depends on your ability to produce, you're still going to see people have significant fear.
Just to also add on one more point to my colleagues, is with the burgeoning of diversity, equity, inclusion, and accessibility that's happening across America, I think a lot of the focus has been on diversity and inclusion, less on equity. And we could argue that part of equity is really expanding the conversation about accessibility of disabled scholars, scientists, researchers in STEM. And we are having that conversation, which is wonderful, but we're having them fairly recently, and having this conference as a platform for that is a good start. And I think that it just gets tacked on when we talk about equity, because we forget that there is a significant number of people in our community that really is trying to champion what equity means, and then really screaming at the top of our lungs, standing on multiple boxes to ask for change to happen on a mass level. And other things get prioritized, and I get that there are very important issues regarding diversity and inclusion, which should be addressed. But let's not forget our disabled community members. And I saw this play out when the pandemic happened, and how the CDC met with almost every disability organization that brought the issue of many of us are at serious risk of dying because there are not measures to protect us. And that conversation really opened my eyes as to how the federal government is, in a way, forgetting the ADA. So, and what the ADA means to protect Americans. So when we talk about disabled people, we're talking about Americans. And let's not forget that we're part of the population as well.
Thank you. We are getting questions in the Q&A, so thank you. Ask and you shall receive. I just want to touch on one more question before I pop in to start looking at those. Dr. Bernard started off by talking a little bit about the in-person, hybrid, virtual conference options that we live in. Is there a preference? And I know the answer, but I'm going to say, is there different accessibility things that we need to think of based on those different options? And I'll let you guys talk about your experiences with those different types of conference environments. Who wants to start?
Well, I have a lot to say. I could just talk for another hour. On its face, the hybrid option seems to be a solution, right? This is a solution. We'll just offer it remotely, and anybody who cannot come because they have a disability, that's fine. They can see all of the talks. But it's really not that. I think that in some cases has become a scapegoat, and it's not really creating equity. For example, just to go back to the thing that I was talking about earlier, which is opportunity loss. And the real work at conferences doesn't happen in a talk. So, you go to the keynote, that's a big conference. You're not engaging with the keynote speaker in most cases. You go to a breakout session, people are talking at you. You might be able to say something in the Q&A, which in most cases you can't do if you're attending in a hybrid fashion. That's not where the meat of the conference and the experience and the value if we're thinking about, what's the value of this, that's not where those things lie. I mean, yes, we're getting educational content, and that's great. So if you're just going to learn, okay, you could make that argument. I don't think anybody goes to conferences just to learn. They go to conferences for a sense of community. We know that when you have a sense of community, that you have, you're less likely to be burnt out. You're less likely to have symptoms of depression. They go to find collaborators. You're not going to find a collaborator in a hybrid situation. And I know that people have created social events for those that attended hybrid. And I think those are met with, hesitation at best. And I don't know of any success. I don't know of all of them, of course, but I don't know that they're successful replacements for what actually happens at a conference. So while that is an option for somebody who physically cannot be there, and I am a good example, I have to pick and choose what I go to because my body, I will pay for it. It's a cost that comes with going, and you're up all night and you're going from meeting to meeting, and the next week is kind of gone for me. So you can only do that so many times in a year, and you do have to choose. But I don't necessarily think hybrid should be seen as an end-all be-all solution. I think you should offer things remotely, but I think you should also be thinking about how to reduce harm and how to increase inclusivity and how to become more universal for an in-person conference. And while we're on the subject, and I just feel a little talkative, one of the things that I will say that's happening that does affect people with disabilities is the cost of conferences are skyrocketing. And I would be remiss if I didn't say something about cost being prohibitive for people with disabilities and people that don't have a lot of resources. So we're talking about a lot of marginalized and minoritized individuals that are no longer going to be able to engage. I have to sign up for a conference today, and it's almost $2,000 for 4 days. That's absurd. And I'm lucky to have the funding, but individuals with disabilities who are taking it out of their very limited professional development dollars, or they're taking it out of, other things, they might be paying for their accommodations out of that budget. They may be on a reduced work. I mean, there's a lot of things that may be going on that would mean that anything that has an additional cost that comes with it would be prohibitive. And gone are the days where I remember as a student, we were sharing rooms. We don't share rooms anymore, and that's a good thing. But also, if you were thinking about doing that as a cost savings, having a disability and needing your privacy to attend to your disability related needs, or needing someone to travel with you to help you. I mean, these are all things that I think people just don't think about that keep others from attending and engaging in conferences, which keeps them from the science, because that's where you meet people. That's where you start to catalyze ideas. That's where you move things into projects and research agendas.
Also,
This conference sorry. Yes, Bonnie or Jenny?
I just want to quickly add too, also when disabled scholars are invited to speak and their cost of attendance and travel is not covered, that could result in tokenism of the disabled speaker. They're invited to share their experience as a disabled scholar, researcher, scientist, yet they have to pay for everything. And they don't have the funds to do so. So that's also to be mindful that could result in tokenism.
I'll add, I think there's lots of conversations right now about team science, right? And those are super important. And I think when we're talking about conferences, there's really good parallels there. And to me, the conversation about hybrid or virtual or in-person aligns. And I think we probably need to do some research, I'm going to be honest, and to support how to best create more universal access to conference, to team science, and to networking. Because, we do have colleagues who are immunocompromised and just honestly won't be able to attend in-person conferences, and we don't want to exclude them. And I also want to say that the cost of organizing a conference is expensive. And so sometimes you have to cap the numbers. As disabled academics who have less opportunity for funding, sometimes we're limited as organizers ourselves, right? So all of this plays into these conversations. I quickly noted in the Q&A, there was conversations about the cost of accommodations, and sometimes solutions are hosting virtual conferences, right? And depending, on the funding and attendance and opportunities, hybrid should not be a uh, substitute for providing accommodations in person. So I definitely want to make that point. But virtual options can also be an all virtual conference can be a really powerful opportunity. And then the other thing I want to add is having hybrid options are helpful also for caregivers, right? This isn't just through a lens of a person with a disability. It's if you have small children or you're caring for someone with a disability, even as a disabled person yourself. And when we're trying to include our international collaborators, again, through the lens of trying to do the best science we can at the fastest pace. And that means including the most diverse minds. And we've got to get creative in how we do this. But I do think we need to do some research on how to do it better and more inclusively.
All right. I think I'm going to transition over to the Q&A. This has been fabulous. Thank you so much for your input and your really thoughtful responses. Our first question is asking about designs that are helpful to people with energy limitations, particularly around social engagement. Do you guys have any ideas or responses to that?
Briefly, one very basic option would be to reserve a room, several rooms for sensory break. I've seen several conferences do this already. They would put outside the door, sensory room, please keep quiet, not just inside the room, but around the area of the room. So people can just go in there. And there are guidelines such as this room is reserved for quiet. So people are not supposed to go in there and just chit chat. There are other spaces for that. It's a room where we just sit and be still and quiet. And there are many ways to build a sensory room and without being, too cost prohibitive. So, and there's lots of advice online that people can look up to figure out how to do this in a hotel room. So that's one very basic, simple option I think would help.
I would add to that just having broadcasting it to large screens outside of the rooms so that we're not, I think you definitely need sensory rooms for people who have those specific needs, with the instructions not to be loud or talkative or anything in there. But I think also when you broadcast it outside of the room, it allows people the option who need to stand up or get up, or people who have restroom related needs who might have to frequently leave the room, to be able to choose another location to be getting the content, if they have to stand or do something of that nature. As far as the energy draining, especially around the socialization, one of the other things that we know empirically that really helps people is finding, I talked about finding a community in the broader sense of finding a community within, like if you are working on some genomic something or other and that's your community of a small group that's looking at the same science, but community of disability and people who understand you where you don't have to explain everything. So we have lots of special interest groups that are organized in some of these associations that do these major conferences, and to have a disability related group where you can choose to socialize but socialize within that group and not have to explain all of your needs all the time. Being around people who just get it sometimes is really, I feel myself, I don't know about either of our other co-presenters, but sometimes I just feel my shoulders kind of relax in that space. because I know I'm not being judged for something I decide to do. I instinctively know what to do with some of my peers, and they have said the same thing, that when you have that community, it's really nice to be able to spend some social time in a community of people with disabilities.
This is Bonnie. Yeah, thank you for saying that, Dr. Meeks. To me, it's about feeling like you belong. And the reality is, I think we all think better when our guard isn't up and we feel like we belong, and we can, again, do better science, right? That's the goal. I think that this gets back to this conversation of universal design. And I know, again, this is probably a learning curve for so many, but a basic principle is flexibility of options. And so whenever conferences are being designed, or groups are thinking about how to design it, making sure you don't just have one option of how to do anything, right? That there's choices, options. That will create opportunities for more people to be included, and is really the underpinning of how you should be designing an inclusive conference. Honestly, not just for people with disabilities, but for everybody, for lots of reasons. Again, there's a learning curve. But I think also, to Lisa's point about, having networks of people with disabilities, if you're a conference organizer or you're working with a conference planning committee and this is all new to you, partner with an organization that is doing this or knows how to do this. Make sure you are encouraging and including people with disabilities within your organization or within whatever group you're planning, without tokenizing. Let me be clear, right? So don't give them all the work without any of the, pay or the credit. But if you're scratching your head and thinking, gosh, I don't think we have any disabled people in our group, that's a problem. Then that's probably where you should be starting.
And that's a great segue into one of our questions. Okay, sorry, internet glitch. We have a question about kind of the energy that it takes the person with a disability to make those requests and the advocacy. And how do you not get drained? How do you be good to yourself while you are still advocating, while we are waiting for universal design and the rest of the world to catch up with what they should be doing? Do you have any comments on that?
I'm sorry, Lisa. Go ahead.
No.
Go ahead.
It's hard. I think we all probably know this. It's hard because it's a balancing act all the time. I choose to wait until I'm in a good space, mind, body, to do those things because I know it'll take something out of me. Having allies, having other people, I would encourage the allies that are in the room today and those that work in science and medicine to be the ones to ask about accessibility. Don't just make it always the person with the disability that has to ask. And organizations like the NIH or anyone else running a large conference can make it very easy on people by predicting the types of things that they'll need, having universal design where possible, and asking and making it as easy as possible for someone to ask. Because there's that threshold, right? Will they even ask?
So as someone with sensory hyper sensitivities, it can be draining and a lot when people are clapping. And so I'm getting ready to answer the question number 5, so I might be answering it now. I do bring my own accommodations, knowing that conferences are not accessible. And I would ask questions to see, like, do you have this? Do you have these things? And many times conference organizers are very kind and respectful when I ask these questions. So I don't have too much of a concern asking for accommodations, and they do try to work with me. However, conferences are expensive for the organizers. I understand that. And so asking for certain items, they might not have the budget for that. So When I can, I bring my own accommodations, and then I bring extra in case there are others attending the conference who need it too. And I've been to a conference where I saw someone appeared really overwhelmed, and I offered some earplugs asking if this might be helpful, and they took it and said, "Thank you so much, I needed this." And earplugs are not that expensive to buy. You could buy that at the drugstore. Even the dollar store sells those. And so unfortunately, we live in a society right now where conferences are not accessible. So we do need to bring our own accommodations and recognize maybe that's the interim solution for now. No, it shouldn't always fall on the attendees and speakers who attend these conferences to bring our own accommodations. We do need to come up with innovative solutions that are cost efficient, but we need research to be able to figure that out, and bring in industry partners to figure that out, have co-production, co-design work with disabled people who have these experiences and share some ways that they have been creative in figuring out how to bear some of these difficulties and challenges at conferences.
Yeah, this is Bonnie. I'll add, it does take a lot to advocate, and building off of what was said, because that's where we are, is it is all advocacy right now. It is all on our backs, I guess I would say, to make sure we can be included. We're sort of pushing our way, and that's what has to change. I'd say on the other side of the table, not to make this completely an adversarial thing, because it shouldn't be. I understand this need for asks of what are the 5 things I have to do? Just tell me what I need to do, right? And I understand that. And that, just really comes from a place of eagerness to wanting to do something. And I respect that. But also, just not knowing what to do. But I also just really do want to encourage people to understand this is a journey. And there's not just 5 things you can do to make your conference accessible and inclusive for people with disabilities, right? Again, I think it is getting on that road and committing to this journey and this process. That's the thing. And it's constant, and it will always be a process. And so, I think for Jenny's example, if there was a room that is, a quiet space, that might be helpful. And if people at this moment are needing to bring noise canceling devices, that doesn't mean you're done, you're absolved, right? There's still work to be done here. So for example, I can't even step foot into a poster hall, right? That is the most inaccessible space for me at a conference. I can't present a poster at this point. I don't want to enter that space. It is visually overwhelming with fluorescent lights. It is a physical disaster waiting to happen for me. I can't interact with the posters. It's a complete nightmare for me, right? The way that we have things set up. We've got advances if we really want to make accessible conferencing. And I think we can do it. But I think, again, this takes some innovation, and we need to change our framework. This isn't just for people who have low vision or are blind. If we move towards an electronic format, then we wouldn't have to haul our posters the way we've been hauling them for however many years as we travel in those tubes. And, there's opportunities to make them accessible to more people in different ways and translate in languages. There's lots of gain to be had here. So I say all of this because we are at what I hope is a leading edge of change, but it takes a lot of advocacy. So back to your question, Teresa, of how do we kind of save ourselves in this moment? I wish I had a good answer, because I'll be honest, I'm not a good example. I'm tired. It takes a lot of work. And I hope that my students don't have to do all of this work. I hope that all of those in the audience take this all to heart and join us so that they don't have to. Because I have missed tremendous opportunities. I think the only reason I have gotten to where I am is honestly because COVID made a lot of things go online, which was accessible for me. I'm not saying that's an answer for everyone. That gave me a lot of opportunities. Again, I'm not celebrating a global pandemic, but in any way. But if it wasn't for that, I am so sure that I wouldn't have had some of the opportunities I had, because physical conferences are a tremendous challenge.
Okay, I think we have hit most of the questions, and I would like us to, practice what we preach a little bit, and make sure we give people time before the 4 o'clock keynote Eastern time. So I'm just going to ask, do you guys have one last parting thought that you haven't gotten a chance yet? You can pass to. I'll start with Lisa.
Just to thank people for their interest in this session and to coming, and the question. I've just been reading the questions, and they're so thoughtful and detailed, and that's what we need. We need people asking these types of questions. So thank you for coming to this session.
And Bonnie?
Yeah, I would agree. I am really heartened by the interest in this topic and the interest for people to try and make change, and just to encourage that curiosity and that journey of learning, and to also, again, not just limit this to conferences, to apply these lessons to your group meetings, to meetings at your institution. These are lessons that you can apply in any place there are convenings and discussions of science.
And Jenny?
Yeah, I'm very happy that NIH is hosting this fireside chat. I think it's a really important, critical conversation to have, long overdue, I think. And I think that this is just the start of the conversation. It needs to be ongoing, as my wonderful colleagues have said repeatedly. Even with the ADA, we still need accountability. We still need to follow up with assessments and figure out a way to really understand how we can bring equity among our disability community. So thank you for hosting. Thank you to our attendees. I want to leave with one last point. A friend at a conference actually gave me this pin. I don't know if you can see, it's my social battery, and it goes from green to red. And then you can put it on your blouse to show people where your social battery is. And I was the only one wearing it. Many people were wearing it, so I didn't feel alone or, too different. That could be helpful if your energy is drained.
I love it. And I missed the scroll. There were other questions. I'm sorry. But thank you so much to my guests for taking the time of their very busy schedules to talk about something that is quite personal and can be a little bit challenging at times. And I appreciate their candor and their generosity in their time today. So this is going to conclude our fireside chat. I would encourage you all to take a look at the virtual environment, take a break if you need to, however you need to. And at 4 o'clock Eastern time, we will have another plenary session, Dr. Lucy Gilson from the University of New Hampshire. So again, thank you and enjoy the rest of the conference.